Good afternoon, Chairman Schatz, Vice Chair Murkowski, and members of the committee. Thank you for the opportunity to testify on H.R. 5221. H.R. 5221 would amend the Indian Healthcare Improvement Act to establish an urban Indian organization confer policy for the Department of Health and Human Services. The bill would require the Department of Health and Human Services to ensure its agencies and offices confer with urban Indian organizations in carrying out laws relating to Indian healthcare. I'd like to first start off by underscoring the unique and political relationship we do have with Indian tribes before I move on to this bill in particular, because an integral component of the government-to-government relationship is our commitment to regular and meaningful consultation with federally recognized Indian tribes. The Department of Health and Human Services takes its responsibility to consult with tribal governments seriously and first established the department's tribal consultation policy in 1997. And this policy specifically establishes the unique political status of tribal governments, and it is upon that status that the government-to-government relationship is affirmed through the HHS tribal consultation policy. The Indian Health Service tribal consultation policy was last updated on January 18th, 2006. And likewise, it was developed in consultation with Indian tribes and outlines that consultation with Indian tribes will occur to the extent practicable and permitted by law before any action is taken that will significantly affect Indian tribes. Other statutes and policies exist that allow for federal consultation with Indian organizations and confer with urban Indian organizations that by the nature of their business serve Indian people and might be affected if excluded from the consultation and confer process. As part of the Patient Protection and Affordable Care Act, Congress reauthorized and amended the Indian Healthcare Improvement Act and added a requirement that the Indian Health Service confer to the maximum extent practicable with urban Indian organizations in carrying out the Indian Healthcare Improvement Act. In 2014, the Indian Health Service established its first policy on conferring with urban Indian organizations. The policy serves as a guide when the agency seeks input from urban Indian organization leaders on urban Indian health matters. The IHS Urban Confer policy strives to ensure that urban Indian healthcare needs are considered at the local, area, and national levels when implementing and carrying out the Indian Healthcare Improvement Act. The Indian Health Service confer policy has been used since its implementation to ensure that the highest possible health status for urban Indians occurs. The Indian Health Service is the only federal agency in federal government to implement this formal process, and it is a best practice and critical partnership opportunity. The Indian Health Service has consistently heard from urban Indian organizations through the confer process. They would like the opportunity to confer with other HHS operating divisions and staff offices. They have also expressed that the need to confer with other HHS agencies is even more critical due to the pandemic and need for interagency collaboration. The Indian Health Service conferring process works to ensure that healthcare priorities for urban Indian populations are being heard and addressed at the local, area, and national levels. We look forward to continuing our work with Congress on this bill and welcome the opportunity to provide technical assistance as requested by the committee or its members. I'm happy to answer any questions that you may have. Thank you.
Thank you very much. Dr. Clark, please proceed with your testimony.